A local hospital has received an award of excellence because of their nurses. We sent Joe out to get a tour.
I'm back at Robinson Memorial Hospital and I'm joined with Linda Breedlove, who is the Chief Nursing Officer here at Robinson. We're talking about the Magnet Recognition Program. Tell me all about it, Linda.
The Magnet Recognition Program is voluntary, and it's a credentialing process through the American Nurses Credentialing Center. It's based on 3 solid principles of high quality, patient nurse excellence, and then also innovations, advancing the bar. It is the gold standard for nursing.
How rare is it for a hospital to achieve Magnet status?
It is very rare, and in fact it's a worldwide credential, but internationally there's only 3% of organizations that have this credential, and we are one of them. In fact, we're one of 21 here in Ohio.
Now, Linda, what's a hospital have to do to earn this kind of recognition?
It is a lot of work to make this happen. There are over 100 standards to meet in order to be credentialed as a Magnet facility. They're surrounded about some key topics. First one is leadership, all the way from the CEO through the physician, the nurse leader, the staff nurse. Everyone must be online and create this vision of quality. The second key area is quality and quality in nursing care. The third area involves innovation and new knowledge so that you always continue to be on the forefront and raise the bar with new evidence. And the last one, probably most importantly, is empowerment. That nurses at the bedside have the power to control their practice and the care for patients. We call it affectionately the bedside to the boardroom, but it really does involve the nurse having a voice at every level of decision making and collaborating strongly with our physicians.
I think that the Magnet program has inspired our nurses to be as professional and as compassionate as they can be. And I also think that it's inspired them to pursue educational opportunities that have allowed them to increase their knowledge in their field. And I think that all of these qualities together make for a more heightened sense of trust between the nurses and the physicians. And to me, that means that I can always be assured that my patients will receive the highest quality nursing care and that care will be delivered in the most compassionate way possible. And that is very important to me.
And I understand this is the second Magnet certification you received.
It is. We got our first one in 2006, and then they just came back last year and we were re-credentialed through 2015. Now the thing about that is that when they come back the second time or the third time, whatever it is, they expect to see that you've improved over the last time they were there. There's no resting on your laurels. No. It's always raising the bar.
And how does the Magnet certification improve patient care?
There's actually documented research on the outcomes of Magnet facilities and the impact on patient care. They've demonstrated lower mortality rates, lower patient fall rates, lower medication errors, and higher patient satisfaction.
And that, of course, affects the community too, because it benefits the community.
Absolutely. You know, the community benefit, especially for Robinson, which is a county hospital here in Portage County, and the only one, by the way, in the county, is that Magnet brings with it a high reputation for excellence in nursing and allows us to recruit the brightest and the best. We compete in a healthcare market that's pretty incredible in Northeast Ohio, and so for you as a Portage County resident, you know the nurses in your organization are the same caliber and top notch as anyone else in the country. The other thing it allows us to do is keep them. By attracting the brightest and the best, Magnet nurses are happier nurses and they tend to stay. Our turnover rate right now is in single digits, very, very low. Most of our nurses have 15+ years of service.
I chose to work at Robinson for a lot of reasons, but most importantly, I've worked at hospitals that do not have a Magnet designation, and those that do. It's very obvious that patient care is a top priority. I love being a nurse, and I want to work somewhere where patient care comes first.
Linda, as Robinson Memorial's Chief Nursing Officer, what's this Magnet journey meant for you?
Well, it's been both professionally and personally rewarding. It has truly been my honor and blessing to lead this fabulous organization on the journey to redesignate as Magnet. But beyond that, I don't have to tell you how healthcare is these days. High stress, high pace, very frustrating at times, and sometimes you forget why you chose the work you did. For me, this journey has helped reground me grassroots of why I chose to be a nurse. So it's been a wonderful experience.
Well, to find out more about Robinson and what good they do, log on to robinsonmemorial.org/Magnet.
Now let's send it over to Michael, who has our APL Dog of the Week.